1 month before a heart attack, your body gives you signs. Please pay close attention to these signals. They could save your life. I'm a cardiologist, and I've seen up close what a heart attack can do. The saddest part is that in many cases, the body had already given signs. That's why I'm asking you to listen carefully and help share this with everyone you love. Sign number 1, pressure or tightness in the chest. This is the most classic early warning sign. It may feel like a squeezing or fullness, not necessarily painful, and it can come and go. If you're brushing this off as heartburn or stress, don't. It could be your heart struggling to pump. Sign number 2, shortness of breath, even at rest. Your heart and lungs work together. When your heart isn't circulating blood properly, your breathing gets harder, not just during exertion, but even sitting still. Sign number 3, pain in your left arm, jaw, or back. This isn't just any ache, it's specific, radiating discomfort. For many people, this is the only symptom they feel before a heart attack hits. Sign number 4, cold sweat, nausea, or lightheadedness. If you suddenly break out in a sweat, feel queasy, or faint without clear reason, your heart may be sending a distress signal. These symptoms are often brushed off, especially by women, but they can be just as serious as chest pain. And this is exactly why I recommend adding Shilajit to your daily routine. Shilajit naturally supports circulation and blood pressure, and it helps the body produce nitric oxide, the compound responsible for dilating blood vessels and improving oxygen delivery to the brain and heart. It also contains over 80 trace minerals that nourish your cardiovascular system and reduce oxidative stress, 2 major factors in heart attack prevention.
Imagine that the heart is a muscle that functions as a pump. A heart attack often begins with a blockage in the left anterior descending artery, where a plaque ruptures and a clot begins to form. This clot obstructs blood flow, depriving the heart muscle of oxygen. Within minutes, heart muscle cells start to die, causing intense chest pain. The lack of oxygen triggers a cascade of electrical abnormalities, leading to ventricular tachycardia, a dangerously fast heart rhythm. As the heart struggles to pump effectively, it can spiral into cardiac arrest, where the heart ceases to beat altogether. Medical intervention is required to restore blood flow and a normal heart rhythm to save the patient's life. Remember, time equals heart muscles.
So you got him at 150? 150. Go ahead. Okay. Sync.
Sync. Sync is blinking.
Okay. Go.
Ready?
Go.
3.
Charge. Go.
That was me whenever I was 26 years old, getting 200 joules directly through the chest. And let's talk about it. I was under a lot of different stressors in my life. All of that contributed to me going into what's called AFib RVR. AFib RVR is essentially where your heart is just like, oh my God, what the hell? You know, it's very irregular. A normal heartbeat is very rhythmic. So they have to do one of 2 things. They either give you a medication through your IV to chemically convert you, or they hook you up and give you some Edison medicine. The chemical conversion did not work. I got the shock. Not that big of a deal. You don't feel a thing.
Jonathan. Oh, do you go by Joe or by Jonathan?
Jonathan.
Okay.
Oh, that's my mom. Just shipping. I'll pick up later.
Do you mind just light a key? So I'm just going to put this on here just for a second. So I have a young gentleman that has something called atrial fibrillation, where the heart is beating irregularly.
This morning, as I woke up, and it's as if I ran like a marathon, so my heart was just going off. So usually a heart beats by it goes boom, 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 boom. Right now, apparently it goes boom, 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 boom.
We typically don't want people to remain in this irregular heart rhythm for a prolonged period of time, so we're going to use electricity to change his heart rhythm from this irregular back into a normal rhythm.
Those are the pads that will give you the little shock, okay?
they knock me out and shock my heart back to normal.
Let's put this on your finger.
Okay.
It's a pretty scary concept, and what the risk factors are, what could go wrong. Well, we could give them entirely way too much medication and completely put you to sleep to the point of view that you stop breathing. Then there's a whole bunch of risks associated with that.
You've had this done before?
No.
Okay. So we're going to give you some sedation soon, okay?
He seems actually quite blasé about it, more so than I would be. Okay, so we're going to put you to sleep, okay? Might sting in the arm a little bit.
How are you feeling there?
I thought it was
I'm just gonna put him on 4 liters.
How are you doing, Jonathan? Okay, let's charge.
Everyone clear?
Deep breath in, Jonathan. All right, big breath in. Big breath in. Deep breath, Jonathan. Big breath, big breath. Jonathan. Oh, there you go. Slowly, let's go. Can you give us a thumbs up?
Quite a deal. Sweet.
We'll sit you up.
There we go.
He got maybe a little bit too much sleep medication. We had to yell at him a few times to remind him to breathe, which he did.
Jonathan. Hold on.
Is it done?
Hold on.
Oh. How long was I out?
8 minutes?
Oh, okay.
Not long.
And the patient can go home half an hour later after the procedure. So your heart, does it feel any different now?
Actually, it's much better. Doesn't feel that stress like after you did a long run or like after you did hard run stress.
He's a little young to have this atrial fibrillation. He's got follow-up with the neurologist to try and figure out why exactly he had these symptoms.
I'm glad I'm back in normal, I guess.
This man's about to get zapped. This is a procedure called cardioversion, and it's meant to reset the heart rhythm.
Alright, clear. Oh, holy shit!
Yeah, that one hurt.
How you doing, Bill? Alright, I think Bill's asleep. Okay, let's go ahead and get going. Okay, we're about to start here. I wouldn't touch him, actually. Is everyone clear? Alright. Go ahead.
Here we go.
Gotta hold it down.
There it is. Oh. 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 Oh.
Doesn't appear to.
Deadly arrhythmia. The heart rate is 230. The heart is beating out of her chest at 5 times the normal, and she's blowing in a syringe, and they're turning her upside down. What's going on here? Believe it or not, they are activating the nature's reset button. When she's blowing against the closed syringe and turning her upside down, that increases the pressure in her chest tremendously, and that activates the reflex via your vagus nerve to slow down the conduction in the heart. This is called modified Valsalva maneuver. Look at her heart rate slowing down. Amazing.
These are the most dangerous heart rhythms and what you should do about them. Let's start with shockable rhythms. Ventricular fibrillation, the deadliest rhythm. This is total chaos. The heart's electrical activity is out of control. No recognizable P, QRS, or T waves. So the ventricles quiver instead of contracting properly. No pulse, no blood flow. Looks like erratic squiggly lines. The only fix? Immediate CPR and defibrillation. Ventricular tachycardia. You have wide and bizarre QRS complexes. The electrical impulses are coming from the ventricles instead of the normal conduction pathway. You can have VTAC with a pulse. The patient might feel faint, dizzy, and you'll treat it with medications like amiodarone or synchronized cardioversion. Or you can have VTAC with no pulse. This is a shockable rhythm, so you need CPR and defibrillation. Pulseless electrical activity, PEA. Looks alive, but it's not. The ECG may show activity, but there's no pulse. Shocking won't help. You need high quality CPR and to find the cause. Supraventricular tachycardia, SVT. You have rapid, narrow QRS complexes with a rate over 150 beats per minute. The heart's electrical signals are firing too quickly from above the ventricles, and this causes the heart to race. It's usually not immediately life-threatening. It can cause symptoms like dizziness, palpitations. For this, you can try vagal maneuvers, like trying to blow through a syringe. If that doesn't work, try adenosine. Torsade de pointe. This is a lethal twisting rhythm. This is caused by low magnesium. So to fix it, IV magnesium. Defibrillation if there's no pulse.
Do you have a healthcare proxy? You don't? No reason. When was the last time you spoke to your loved ones? Not the living ones. A good question. Humans are not supposed to have that. You're seeing some changes. You know, sometimes they can be subtle. Not this time, but sometimes they can be. Oh, so you went and saw your primary care doctor for this? Anxiety? Well, that's totally valid. I was anxious too. Oh, not him. You were diagnosed with anxiety. Well, that's a stretch. But okay. What have you been doing to fix it? Breathing exercises. Come on now. Did anybody try? They didn't even try. Shook it. Yeah, it sounds like you're here for a good time, but not a long time.